The tripartite evaluation reflects on the quality of the partnerships and the working relationships that we continue to have with our partners. Through their support and collaboration, we have been able to be hardwired into both the federal and the provincial health systems and to continue improving health outcomes for BC First Nations. We thank you, our partners, for walking with us and giving voice to our communities and community members, and we look forward to presenting the findings of the evaluation.
The overall 10-year agreement, which sets up the First Nations Health Authority, does require an evaluation every 5 years. So for the first 5-year period, really the elements that can be measured are the effectiveness of the tripartite relationships, the regional partnership accord evaluations, and those, of course, have been a key element of activity at the regional level and really have created a whole set of opportunities and activities. An overall assessment of the effectiveness of the governance structure, and really looking at the concept of reciprocal accountability, what that means, and really the unique aspect of this tripartite relationship is this feature called reciprocal accountability. So for the first 5 years, those sort of process elements are ones that are really clearly measurable and will be really the subject of much of our discussion. As we go into this first 5 years, there are some elements of intermediate outcomes that are measurable, and in that, such things as the review of the joint project board elements, the primary care project evaluations, and some of our individual project evaluations also will give some insight into some of the intermediate term effectiveness. And of course, the evaluations of the regional partnership accords. So looking long term and being really able to understand the impact of the tripartite agreement and this partnership and set of efforts and initiatives, in the long term, those will be best measured as we're able to collect some of the new data, such as wellness indicators.
And the partnership aspect of this evaluation, I think, speaks to the incredible learning that each of the partners had with respect to being able to be listening to you, to understand your needs and your vision, and to be able to enable that in such a collaborative and concerted way. I think that transparency, as well as the respect and the trust, has endured over all of these years of the partnership. So the second success factor, of course, is building those relationships, and I've spoken to that already, but I haven't really emphasized the importance of reciprocal accountability in terms of the success in the last number of years, but also how to continue to build upon that to facilitate change. And I just wanted to acknowledge, and it is really detailed in the report, the First Nations engagement and approvals pathway, and how significant that was in terms of achieving support from leadership for this transformative change, and how it continues to be of importance to ensure that we never go back to a day where we're looking at tokenistic sort of dialogue or check marks, and it's actually raised in the report as something that key informants note continues to be a concern, and making sure that there are safeguards against that. And as a partner, as a federal partner, we're very cognizant of that and how to ensure to keep BC First Nations engaged very actively in what is happening in the area of health, not just in BC, but also across the country. The regional partnership of courts, of course, is extremely important to ensure that there was an opportunity to come to the table, to build those relationships at that regional level, also identified shared priorities and collaborate on solutions, and engaging First Nations communities, both at the local level, but also at the regional level in terms of service planning and design. And also noting that most regions have evolved to also have operational tables that can address some of the technical issues. And that is something that I'm sure those tables will be interested in the evaluation to particularly look at some of the evidence that they can use to continue to inform their decision making. The report does acknowledge engagement fatigue emerging as a challenge, and so, I noted a lot of opportunities where we engage with the FNHA and the First Nations Health Council, but also ensuring that those opportunities are strategic, and so that we can maximize their time, and also ensure that we are contributing to ensuring the success of that dialogue. Within the context of the transfer itself, the report talks a lot about the challenges and the importance of needing enough time to understand, the federal bureaucratic or systems processes that were in place, such as in information management, information technology, and communications.
The third theme that you will see within the tripartite evaluation report that is now on your table is really around the work to hardwire the BC First Nations perspective on health and wellness into the health system. And you will see it talk about a number of successes that have occurred, including, as both Valerie and Richard have spoke about, the strength of the partnerships that exist and the establishment of regional partnership accords, as well as a commitment by all partners towards our work together in creating cultural safety and humility and hardwiring that First Nations perspective on health and wellness into a single BC health system. The First Nations perspective on health and wellness has really continued to be a fundamental pillar of the work and is now beginning to permeate throughout the system. That includes the use of ceremony and work, embedding cultural healing in Western models of care, and then designing new, more holistic services and models of care based on the First Nations perspective on health and wellness. And as you would have heard Colleen speak about earlier this morning in some of her opening comments, it also includes work that we're doing around First Nations-led primary care initiatives established across the province. So we have some good momentum and progress underway that's been made in cultural safety and humility amongst health system partners. This is starting to lead to action at local, at regional, and at provincial levels, and across a whole range of organizations, not just within direct healthcare service, but also outside of healthcare, such as work that we've been doing with the BC Coroner Service. So although our efforts really are in early stages, and more work absolutely needs to be done, and starting to take some of this work and to help and strengthen it and ensure it trickles down to frontline health providers across the whole system. That is not to say that everything has been a success, and so you will also see there are challenges. We need to work with you and get input from you and teachings and learnings from you on how we're going to move forward to address some of these challenges together. There are still significant real barriers that affect outcomes and ultimately that are still affecting people's lives. There continues to be jurisdictional issues regarding service delivery in communities and away from home across the province, as well as many nations straddle across a number of health authority catchment areas. And while there has been improvement in terms of access to health services, the top reported barriers that you will see within the report in terms of health services by First Nations in community are still challenges with long waiting lists, health services that may not be covered under FNHA, or a lack of awareness of what services actually are covered. Feedback, feeling that some of the healthcare is inadequate, or not being able to afford some of the required direct healthcare within communities. And importantly, that we still need to do work in order to address persistent racism and discrimination across the system and move beyond the training and education that we have been doing and to help ensure that that training actually moves into action and initiatives that achieve systemic change and eliminate racism across the system.
The agreement is generating value through new investments. And part of that has been done through the possibility of flexible funding streams that really have positioned FNHA to put in place funding sources that combine both what we know as traditional Western health resources and accompany those with traditional and cultural approaches. The other aspect of the flexible funding agreements really is that mental health and wellness has been shown to be the #1 priority in each of the regions, and the investments of FNHA have really closely followed that in terms of allocating new resources to devote to mental health and wellness. A related aspect really has been the data that was talked about very briefly, and I would say as well the primary care projects and project board, which are investments of upwards of $25 million a year, which are matched as well by provincial investments, are really significant and are generating new opportunities and new resources. In any funding system, there are times where some of the funding sources are temporary, and I would say that these create challenges, and part of our really need in the future is to make sure that as we go along, we clearly identify those opportunities which are short-term, but that we manage those in a way that's long-term and sustainable. The other element is that it's really also important to look at how do we base and examine growth of the organization and how this relates directly to services in communities and is there to support those services in communities. So it'll be important to really make sure that the organization grows in ways that are sustainable, but again, are focused really on being efficient and being sustainable. The other challenge is that, and this was well described earlier, that our funding base generally is targeted at home service populations. Although over the last couple of years we have generated new opportunities for away from home and urban clients. Our First Nations Health Benefit Program, of course, already provides services across the province regardless of residence.
Certainly, the reports to date reveal that there have been some modest improvements in several of the First Nations Health Plan indicators, but inequality between the First Nations population and other residents of BC has increased on 3 of the 5 indicators. So 3 of the 5 indicators that are showing modest improvements are life expectancy, age-standardized mortality, and youth suicide. Infant mortality rates have not yet changed, and I say yet. There is still a higher diabetes rate for First Nations compared to non-First Nations population. But overall, the report acknowledges, which is absolutely correct, that 5 years is not a lot of time to see some observable shifts in health outcomes at a population level. But significant progress is being made with respect to precursors to wellness. And one of the key elements, of course, is the work, including by the First Nations Health Council and by federal and provincial governments, to work collaboratively with respect to the determinants of health, and really ensuring that that we are looking at, particularly within the next 10 years, how can we build on this partnership to influence social determinants of health?
And then in terms of what is next, over the next months to year, there will be a number of opportunities that will be coming through caucus and other venues to now allow you the opportunity to take this report and the findings back to your own communities and have a dialogue so that we can begin to work with you and understand what should be created in terms of recommendations as a result of these evaluation reports. So you won't find any final recommendations as yet, because that is now the work that we need to do together.